everybody. I'm Mary Ellen Duggan. I'm the District Health and Wellness Coordinator, and I have some special guests here with me today. And we are going to talk a little bit about heading back to school and keeping everybody healthy and safe. So I will let each of you introduce yourselves, and we'll start with you.
Hi, I'm Andrea Saranello. I'm an infectious disease physician at Mass General in Boston and the parent of 3 children in the district.
Hi, I'm Safdar Medina. I'm a general pediatrician and the school district physician, as well as a parent of 2 children in the district.
Hi, I'm Emily Amico. I'm the public health nurse in the town of Southborough for the Southborough Board of Health.
So we're so lucky to have all of these great experts with us today. We also, as part of our medical team, we have 2 other emergency room physicians, Dr. Jennifer Carey and Dr. Amy Costigan, who are also part of our medical advisory team that has been working tirelessly with me, and I am totally indebted to them. So we are just so excited to get everybody back into school. And there are a lot of things and there are a lot of questions, and school is going to be new experience for everybody, but it's really exciting to be part of this learning adventure. So we're going to just start off with a little brief overview of what COVID-19 is and how it's spread. And I will let Dr. Medina or Dr. Saranello talk about this.
So COVID-19 is a coronavirus, as you know, that is spread by a respiratory droplet, meaning that it's something that we exhale, whether it's through speech or coughing or sneezing, and it's a droplet. It's a very heavy droplet that will travel in the air and then fall to a surface. Coronaviruses are a very common virus that are around in our community. There are a variety of coronaviruses that cause the common cold, but COVID-19 is a novel virus that we are now learning more and more about.
All right, thank you. So currently there's no vaccine, but there is in the works. Lots of people are working on a vaccine. So their best way for us a best preventative strategy is to avoid exposure and to reduce our risk factors. So we do that by wearing a mask, by practicing our social or physical distancing, and by washing our hands properly, and by keeping our hands away from our face. So those are the 3, that's like the trifecta, that's like the triple layer of protection that we have, that we can do ourselves to protect ourselves and decrease our risk. So Dr. Medina has seen a lot of children in his practice throughout the summer, in his pediatric practice, and he could talk a little bit about the illness that he's seen this summer, or not seen.
So thankfully, children are less affected by COVID-19, both in terms of acquiring it and in the severity of it. As just a reference point, the last positive test I've seen in my clinical practice was June 26th. Since then, I've tested well over 100 children that were symptomatic, mostly in daycare and day camp settings, and thankfully they have all tested negative. In fact, I got a report on 10 today that tested negative. Certain children may be at risk, and as the slide says, that those are parents that should discuss their conditions with their primary care doctors. But what we have seen has been very reassuring. What we're actually seeing a lot is some of the negative effects of not being around peers in school and not having teachers in their lives. And to that end, we're seeing a rise in mental illness, a rise in eating disorders. In fact, UMass Medical Center has had 0 admissions in pediatric patients for COVID-19, whereas has seen an increase in admissions for suicide attempts and eating disorders.
So returning to school is very important for all of our students. If you have concerns about any specifics for your child returning to school, we suggest that you talk with your child's medical team about any concerns that you have, and then you can make an appointment to meet with me or your school nurse to discuss it further. So Dr. Medina talked a little bit about how COVID-19 spreads, and this is just a little pictograph that really shows how it's transmitted, and I can let Dr. Saranello explain this a little bit, since this is her expertise.
Sure. So we think that the primary mechanism by which COVID-19 is spreading is through respiratory droplets. So that is when you cough or sneeze, or even just talk or breathe out, you expel a little bit of respiratory droplets each time. And for someone with COVID, the virus can live in those droplets. And as Dr. Medina said, they travel through the air for some distance and then they fall to the ground. And I think it's important to realize that they're not wafting through the air for long distances the way that other truly airborne infections are. But what matters is how far those droplets go and where they land and whether they land on another person. And so the things that we can do to prevent that is really to wear a mask ourselves so that if we happen to have COVID and we don't realize it, we're not expelling those respiratory droplets out into the world. And then staying an appropriate distance from other people, even with masks on, and making sure that we're in areas that are well ventilated. So the ventilation in the schools has all been evaluated and improved to try to make sure that the airflow is being exchanged frequently and those respiratory droplets are getting cleared out. And then the other way that we think that it is transmitted is probably a lesser contributor to transmission, but has to do with touching of surfaces. So if you were to sneeze on a surface and you had COVID and someone were to come and touch that surface and then touch their own face, especially their eyes or their nose, it's possible to introduce the virus that way as well. We think it lives on surfaces for some number of hours. That's been hotly debated, but is probably less than a day. And so all of the cleaning approaches that the school's putting into place to try to disinfect all the surfaces will help get it off of the surface if it happens to be there. And all of the hand washing and avoiding touching of faces and eyes and nose and mouth will help prevent transmission through this route as well.
Thank you. So as we said, the ways that we can protect ourselves to decrease our risk factor is washing your hands. It's always been the number one way to stay healthy, and it will always continue to be the number one way to stay healthy. Keeping your hands away from your face, wearing a clean mask properly, practicing social or physical distancing, staying home if you're sick, and cleaning and disinfecting high-touch surfaces. So these are all things that we can do ourselves to decrease our risk factors. So we do have some things in place for returning to school. And we are asking everybody to do a daily health screening checklist. And this checklist will go through symptoms of COVID-19 or coronavirus. I will bring up the checklist. I'm not sure, there we go. So prior to sending your child to school each day, we're asking that you complete this checklist. And if you answer yes to any of the statements, then you cannot send your child to school and you need to contact the school nurse and your healthcare provider. So I will let Emily go through the symptom list since she is our expert at the Board of Health and she has been talking to a lot of people this summer about doing contact tracing and following any positive cases. Although there's been a small number in Southborough, the contacts that those people have been extensive, and she has touched base with all of those people. So I will let her go through the symptom list that parents should be looking for.
So I want to thank all of our residents for keeping our numbers low and practicing all these great mitigation strategies, but also being aware of your symptoms or any potential symptoms of the people in your family, and making sure you stay home and contact your primary care provider if you have any of the symptoms or if you have any questions. The first symptom would be fever, and we're defining fever as 100 degrees Fahrenheit or higher. Fever can also present as chills or shaking chills. Some of the respiratory symptoms that people have exhibited with coronavirus are cough, that's not related to a chronic condition that you may have, any difficulty breathing or shortness of breath. One of the symptoms that we're seeing specifically with this novel coronavirus is the new loss of taste or smell, and also sore throat, headache when in combination with any of these other symptoms, muscle aches or body aches, nausea, vomiting, or diarrhea, fatigue when in combination with any of these symptoms, or nasal congestion or runny nose. not due to any of your typical chronic illnesses, such as allergies.
So Emily, can I just interrupt there, because there's been
Yeah.
a lot of questions about what about my child with a regular cold or allergies? And I know my child has seasonal allergies, and we know there's ragweed or goldenrod is in bloom, or when the pine comes in bloom. How will we be able to tell the difference? Anybody can jump in here, I think, to answer this question. That's a question that comes up a lot, even with our staff and with the parents.
Well, you know your family best, and knowing that you may be allergic to the ragweed and you have those typical symptoms, just closely monitoring and asking your primary care physician if you have any questions or doubts.
And I think the moment your symptoms deviate from what you normally have is when you want to know. So if your allergy symptoms are primary or runny nose or itchy eyes, and you suddenly develop a cough or feel tired, then you know there's something more going on. So that is really important. It's important to know that runny nose is in combination with another symptom for us to consider COVID-19 as a possibility for an illness.
Thank you. So the other thing, in addition to symptoms that you'll be answering the statement below, is if you're a household member or a close contact to anyone with a known diagnosis of COVID-19 in the past 14 days. So a close contact, I will let Emily describe this because she is an expert on doing contact tracing with close contacts of people. So
You would be considered a close contact if you are in contact with someone within 6 feet for greater than 15 minutes. So that's why we're saying social distancing, physical distancing of 6 feet, and then it has to be greater than 10 to 15 minutes in order to be considered a close contact. So walking by someone on the street is not considered a close contact unless there's someone like physically coughs on you or sneezes on you.
okay, so what if somebody coughed or sneezed on me while I was walking by, but we both had our masks on? Do I need to be concerned?
So your mask is reducing your risk of exposure. It doesn't eliminate risk. So just keeping an eye out for any symptoms, and I wouldn't consider you a close contact necessarily, but.
Okay. Do you have anything to add?
No, I think if you are around someone who has a known diagnosis of COVID and they cough and sneeze on you even with a mask, that we would like you to report.
Yeah.
I think if you walk by someone on the street and they cough into their mask as you're walking by wearing a mask, that's a very low risk encounter and wouldn't be considered an exposure. That sound fair?
Yeah.
So, or if you live in if one of your household members is diagnosed with COVID-19, you are definitely a close contact. So that is no ifs, ands, or buts about that. So, and then travel. You know that Massachusetts has a new travel order, and the lower risk states have changed since the travel order was first instituted. So this is a link to the lower risk states here. Hawaii was recently taken off, and Rhode Island was taken off. So there's a whole metric that the state uses to figure out who are the lower risk states. But if you travel outside of those lower risk states, when you return to Massachusetts, you need to quarantine for 14 days. You cannot test out of quarantine 14 days, whether for travel or whether you're a close contact. I think that's an important thing to notice. So this is a checklist that you will go through each day. And it will be like brushing your teeth. Is that when you do it when you're sitting down to breakfast? You notice your child's not themselves this morning. Please do not send them to school. I can't stress that enough. There will be things that they can do online. The teacher will set things up for you. So just know that if your child is not themselves, and if you're even questioning it, it's better to err on the side of caution.
Should we talk a little bit about what happens in that situation for parents?
Oh, sure.
So I think this is something that's going to happen, unfortunately, very frequently. We all know how often our kids have colds and runny noses. They're actually much less likely to happen this year with all of the masking and cleaning and distancing that we're putting into place. Places, for example, in the southern hemisphere that usually have bad flu seasons have had incredibly mild flu seasons this year. So I'm hopeful we'll see a little bit less of the usual kind of, viral kid crud that we usually see. But I just want to underscore what you said about the importance of really keeping kids home and staying home as adults too if we don't feel well. It's like probably the number one thing we can do in addition to masking and distancing. And it's going to be really inconvenient. It's going to happen a lot. It's going to mean days off for parents. And I think we just all have to have, as working parents, have a backup plan and a backup plan for our backup plan, because this is going to happen a lot. But the district has done a lot of work to try to make it as easy as possible for when this does happen. So when kids have symptoms that meet those criteria, they need to be tested for COVID. And there will be a couple of places that the district is working on to try to make that easy. So where you can go, get tested quickly, where we have confidence that the results will come back quickly. So we want to steer you to places, not some of the commercial labs, for example, with really long turnaround times for results in the week or longer range. We want to steer you to places where we know we can get those results back in a couple of days at the most. And so there'll be information provided about that to help parents. And then once you have the test result, if it's negative, we need you to call your primary care doctor, your healthcare provider, and get clearance to come back to school or work. And we'll hope very much that we can get you back in as quickly as possible for your next day in school, or at least the one after that. But I wanted to underscore that a bit because I want people to start to make plans for what they'll do on those days when our kids inevitably do wake up with some kind of symptom.
Thank you. So as we prepare for our return to school, there's a lot that we all need to do. The things you can do to get ready for school with your child, you can work on the masks. If your child, the masks, there's lots of questions about masks. So we can just stop here right at this first bullet here and talk about masks. The medical advisory team has decided that gaiters and bandanas, until we have more research on them, are not going to be allowed in school. So a mask is what will be allowed. The mask cannot have one of the vents. I tried to find somebody that had one, but nobody I knew had one.
That's good.
Same with me.
So you've probably seen them. They have the little air vents there, and those are not allowed either. So the three things that are not allowed are gaiters, bandanas, and the masks with vents. There are many different other kinds of fabric masks or the certain medical masks that you see everybody wearing here today. Mine is not that great today because it keeps slipping down. So I need a little bit of a tighter fit here that it's not that great, but it matched my outfit. So, and I'm not a so this is an example of a mask that wouldn't be a great fit. So everyone is expected to wear masks. Every adult, every student on the bus and in school. So we are asking that you send at least two masks to school with your child. There are a lot of questions that have come up about the masks. What if my child won't wear a mask? What if my child can't wear a mask? So I will let maybe Dr. Medina talk a little bit about that, about working with your child to wear a mask and practicing.
Sure. So first thing is, kids are great. They will go with the flow. We see kids in my clinic all day long, and they're all wearing masks. In fact, they're better than their parents at wearing masks in the clinic. So I've been very impressed by them. Daycares and day camps have had no issues with mask compliance. I think it's up to us to present mask wearing as a norm. A lot of families have asked, hang your masks where you hang your keys. So you grab one or leave one in the car. Just make it so normal and model that behavior, and kids will do it. Get them practicing now by wearing a mask at home for a few hours a day. You'll be surprised how quickly they get used to wearing masks. So I can't underscore that too much. Right now, we're going to talk more about this, but there are very, very few medical exemptions for masks, almost none basically. Kids with asthma can very comfortably wear a mask and their breathing will be perfect. And any children with sensory issues or developmental disabilities the trained staff that work with them can work with them to keep their face coverings on.
So I think that we need to give our children the benefit of the doubt that they are more resilient than we give them credit for, and I think that they did a really good job during the summer program. The students wore masks and they did a great job. If students can't wear masks for any of the reasons that we will get into, the staff will have extra protection and will be wearing a mask and a face shield. So there are lots of forms on the district website to help you, and there's on this, I will show you where the links are here, but this is all kinds of wearing a mask toolkits and social stories, all kinds of things to help your child get used to the idea of wearing a mask, why we wear a mask, and just practice wearing it. I think the more we practice it, the more we normalize all of this, the better off it will be for everybody. Do you have anything else to add about the masks?
I think the only thing I'll add is that for older teenagers, we have to remember that this is a really socially conscious generation of teenagers, and I think we really have to impress on them that they're doing this for the good of society, and teenagers will be very, I know a lot of parents have expressed concerns about their teenagers wearing masks, but I really feel that they will do it for the greater good.
I was just going to say, on the other end of the spectrum, I have a 6-year-old at home, and we were having trouble finding a mask that would work for him. But after multiple attempts, we found a great brand that works for him. It's just like a mini surgical mask for pediatric patients, and he's excited to put it on. He's a nurse like mom.
So I think I've heard a lot, when my children were younger, helmets were just coming in, and they were the things. It's going to be like wearing a helmet. It's going to be like wearing a seatbelt. When I was growing up, I never wore a seatbelt. My kids were the ones that reminded me to buckle up, Mom, when we needed to wear a seatbelt. So, there's going to be people that we see that don't wear masks, and we need to know that we need to encourage everybody that this is keeping everybody safe. Our numbers in our towns have been low, and we need to really work on keeping them low. I think that's so important, and there's that community commitment and the social responsibility that we have to each other to work on this and to get through this all together. I think that's really important for all of us to remember that we are all in this together. I know you've heard it a lot, but I just went through this wearing a mask at school. Some questions that came up about the masks were mask breaks or sensory breaks, and how is it going to work, and were masks going to be needed to be worn at recess. So the mask breaks will happen throughout the day. There are guidelines that need to be followed, and the teachers all know those guidelines. Students need to be seated. Lunch will be a mask break. Recess will not be a mask break. As we said, we decided to start things out most restrictive, and then as we watch the metrics and see how things work, we may be loosening up on some of those restrictions, but for now, I think the safest way to start everything is in the most restrictive thing. So the masks will be being worn at recess at this time. In the elementary school, students will have a lanyard, a breakaway lanyard that has a pouch on it. Like think if you've ever went to a conference and you have your pouch, or like a press pass. So during their mask breaks, if it's not at their desk where they would take their mask off and lay it down with the inside facing up, they will fold their mask in half and stick it in their pouch with the straps. I will show you here. They would fold it in half, stick it in their pouch with the ear loops facing out so that they could easily pull it out of their pouch and open it and place it back on. And this is a lot of the teaching that's going to go on in those first few days at school, just like the start of every year, where they're learning all the routines and how things work, and wearing your mask and mask breaks and when to take it off, and when to wash your hands before you take it off and after you put it back on. It's all going to be part of the new routine of school. Were there any other questions about masks that...
No, maybe to clarify, you mentioned sort of seeing people in the community without a mask and encouraging them to do their part. there are not going to be people without masks in the schools. So
Correct.
I wanted to clarify that point. I think the expectation will very much be that everyone here will have masks on all the time. And for the few students who have difficulty with it, they'll be coached, actively and in an ongoing way until they get there. Is that right?
Exactly. On the bus and in school, masks are required. So I think if that was confusing, I apologize.
No, I just wanted to make sure people heard that we meant here there will be masks.
Dr. Medina, do you want to talk a little bit about our mask guidelines, about what we're doing, and what we decided about the gaiters and bandanas?
Sure. So at this point, we are requiring masks that are cloth masks as we have on, or surgical masks. This one that I have actually has 2 straps that go over your head for people that don't like something over their ears. So there's definitely all different kinds of face covers that come up, but it must be a mask. The studies on gaiters are inconclusive, therefore, we can't guarantee that a gaiter is safe at preventing spread right now, so we are not allowing gaiters in the school building as face coverings or bandanas at this point.
All right, perfect. So the masks need to be worn. This is an important thing that sometimes gets confusing. Even though we're 6 feet apart, we're still wearing our masks.
Mm-hmm.
So all day long in school, except for when we're having mask breaks or when we're eating, masks will be worn. I think that needs to be reiterated over and over again because it's a little bit confusing for the adults too. So, so the mask exemptions, I'll let you take this one too.
So again, right now the list of exemptions is extremely small, and that is someone who's actively having trouble breathing. So somebody in the middle of an asthma attack, not someone with a diagnosis of asthma, someone who's unconscious, incapacitated, or cannot remove the mask or face covering without assistance, i.e. someone with appropriate developmental delays to that effect. So that is pretty much it for mask exemptions.
Okay. So additionally, if anyone has a medical, behavioral, or other challenge making it unsafe to wear a face mask, they would also be an exemption. And they would need a note of that exemption from a licensed care provider. So this is a great district reopening website. This is just I took a little screenshot of the district reopening website. But anything you ever wanted to know about what's going on and what has gone on in the past 5.5 months, you can find here. So this is the actual site. So there is everything from A to Z and everything in between. The health and safety protocols, if you want to know what the protocol is for recess, you can go right to Appendix A and you can look at the guidelines that everybody is seeing. What are the guidelines for art class? You can go there and find that out too. So if you see something that you think might need a guideline and it's not there, just let us know. So if you haven't seen this site, I highly recommend it. If you go to the regular nsborough.k12.ma.us, and it's called the Fall Reopening website. So I think this is a great resource for if you have questions about anything. And your specific school information is included in here also. I think maybe we'll stick here and answer some questions and then go into about the pods. People like questions about school, and then maybe we'll go into questions outside of school. So some people had some questions about if their child has asthma, will the cleaning products be changed in their classroom, or do we think they would impact their asthma?
So from what we know about the cleaning products, the answer is no. Any spray kind of cleaning will be done when the children are not in the classroom. So when they're in the classroom, all the products are the common products that are already used.
Okay, if my child sees the nurse, this is a question that comes up, needs to go to the nurse for anything if they have an underlying condition, whether it be asthma or diabetes, or they need to take their daily medicine or have a procedure done. how will I know they were safe? I can answer this one. So everything about school, like I said, is going to be a little bit different than what we're used to in the past. And the teachers will need to call the nurse before they send anybody down. So if your child, the nurse will know your child has a known history of asthma, if that's what you were concerned about. And they will not be going to the medical waiting room or the isolation room to be assessed. They will come to the health office, and then the nurse will do their assessment and then decide what needs to happen from there. So I think that was questions about that. Lots of questions about the masks, and I think we covered most of them. I'm looking to see what else there is. The symptoms about not coming to school or coming to school, we covered all of those. If a child or a staff member tests positive, this is a question that comes up. I don't have I could find it on our district reopening website, so here we go. I'll show you how to do that. So if a person tests positive, we can go to the health and safety, appendix A maybe. Hopefully it'll work for us. There we go. So you can find out everything, like I said, from A to Z with your things. So we will go to the guidelines for a symptomatic student. What happens? I'll zoom in. Dr. Cianello, you want to take this? Or?
Sure. So the question was around, this is a nice outline of what happens, for example, on the left. If you say yes to any of those symptom questions, this is a little bit what we were talking about before. You'll call the nurse. They or Dr. Medina will direct you to one of the testing centers that have been arranged to try to make it as easy as possible. If you're tested and you test negative, then you can come back to school, or your child can come back to school when they have been fever-free for 24 hours and their symptoms are improving. If they don't get tested, we're going to ask them to stay out for the full 10 days as a precaution. This is what you would also do if they had tested positive. So this is to be as careful as possible to protect everyone else in the school. So that is a long time, and I think the best way to avoid that 10-day time out for you and your family is going to be to try to pursue one of these testing avenues that's going to be made available to the district. If they go see their doctor and the doctor is sure that they have something else, for example, this is the migraine headache that they always have with a little bit of nausea because they always get that, and your doctor will write a note then saying that that's what this was, and you can come back to school once your symptoms are improving. But I think the question was around if you are tested and test positive. So in that case, this is the standard recommendation for all people with COVID. If you are well and staying home, but just recovering from your COVID at home, then the isolation period is 10 days. And it's 10 days from the time that your symptoms started, or if you never had symptoms and you happen to have been tested, it's 10 days from the date of your positive test. And then once those 10 days are up, if you have not had a fever for 24 hours and your respiratory symptoms are improving, then you can come back to school. And then Emily will get involved, and all of the people who were close contacts of the person with COVID will be contacted. We'll arrange testing and sort of, I don't know if you want to speak to any of the additional details there.
So once someone is identified as a positive case, then we do what's called contact tracing. And we identify any close contacts, including household contacts. And then they're referred to test for their own testing, and then they're put onto a 14-day quarantine to closely monitor their own symptoms to see if they may present with COVID symptoms within that 14-day period. I think that's it.
Yeah. I think this is very unlikely with the low numbers that we have. Hopefully we'll see this just a couple of times during the year. But it is important to kind of, as I talked about, backup plans for backup plans. Like if someone in your household is diagnosed with COVID, then they're considered infectious for 10 days. And you are quarantined for 14 days after the last day on which they were considered infectious. So assuming that it's someone in your house that you need to stay in contact with to help care for during those 10 days, that's 24 days. So if it were, for example, an older adolescent who you could really quarantine in their room and not go near them at all, you could have a conversation with Emily about whether that was sufficient isolation. If one parent is able to do that so that they can have a shorter duration of isolation, that's something we can talk about with Emily. But in general, I mean, I think this will happen rarely, but it is something that will mean a lot of time out, taking care of your family members and then being quarantined thereafter.
And each circumstance is a little bit different, so that's why we have to talk it through with each family. So
I think it's important to know that the contact tracing will be done with Emily and the school nurse, or the Northborough. If you're from Northborough, it would be with the public health nurse from Northborough, who's Ann Labonte, and we would work closely with them. Close contacts, remember who those close contacts are. They're household members, or if you've been within 6 feet for greater than 10 to 15 minutes. So that's considered a close contact. That's with or without a mask. So the close contact within 6 feet for greater than 10 to 15 minutes. If you are part of an elementary school classroom cohort and someone tests positive in that classroom cohort, that cohort will be considered a close contact because they spend 6.5 hours a day together, and we're treating them like a household. If it's a middle school or high school, we will do the specific contact tracing, so students will have assigned seatings in all their class, assigned seatings at lunch, assigned seating on the bus, so that we can do that contact tracing adequately. So on the bus is the only place on their trip to or from school that they will be within the 6 feet. So there's not, on the bus ride, they are socially distanced, but not the 6 feet. They're the 3 feet on the bus. So I think that really gets confusing when we're talking about contact tracing and what's gonna happen, but each case is dealt with individually, and you're not left on your own to figure it out. Emily or Ann will work with you, or the school nurse will work with you too. So that's if someone tests positive. We talked about who shouldn't and should come to school, when you should keep them home. There were some questions about the air quality. And we have had Kailash the air quality engineer, has done an amazing job for all of us. If you go through a lot of the school buildings now, you'll see that there are HEPA filters on the inside rooms that are working. They will be doing some trial runs with having 10 to, I think, however many students, the max that can be in that classroom. At the high school, some classrooms, I think, are as big as 13 or 14, and they're spaced out nice. I think Dr. Medina said Mr. Martineau sent out pictures of what the classrooms look like. So you can see those, but they are going to have people sitting in those seats and check the CO2 levels while there's actually that many adults in the classroom, to see what they are and make sure they're all okay. When will school be shut down? Hopefully never.
Right.
So that's what we're hoping for. We do have guidelines that we go by. The state has a map that they have made. Emily, do you want to talk a little bit about the color-coded map?
Sure.
Are you comfortable
It
with
can
that?
be found on mass.gov, along with a lot of other great resources. But just within the last couple of weeks, the state has come up with a color-coded map, and it's white, green, yellow, and red based on the transmission rate and number of cases in each town. So we are looking at, right now, we're in the white, which means we don't have any cases within the last 14 days, or a very small percentage per 100,000 people. So, and then once we reach yellow or red, we'll have to discuss if there's any transmission within the schools, and determine that while working with the state public health department as well. So
this medical advisory team along with the state public health department and other public officials, would decide what needs to happen when we get to the yellow or red. We do have some guidelines, and you can find these in Appendix A, about what, and it tells you about the close contacts. This does give a lot of definitions here. But if there's more than one unrelated confirmed COVID-19 case, then our COVID response team, which was the administration, the medical advisory team, public health officials, would meet and to determine if there's in-school transmission happening. And then we would take steps if we did suspect that. The steps are outlined there. And then if there's multiple cases in multiple schools, we would meet immediately again to make the same kind of decision process and decide what needs to happen. Where is the spread happening? And this is where you will find definitive, like very in-depth definitions of a close contact, quarantine, and isolation on this page here. So outside of school. So we've talked a lot about what's happening in school, what's happening outside of school. So I know a lot of people have talked about creating pods. And there are some, we can't be prescriptive about what happens in the pods. We can tell you to follow the same safe guidelines that we're following in school, and please ask you to do that, because what you do outside of school affects what happens in school. So we need to remember that our goal is to get our students eventually back into 100% in school. And if we do continue to follow the guidelines and continue to work really hard, having that community commitment and being socially responsible, that is really a goal that is achievable for all of us. So Andrea, do you want to talk a little bit about the pods outside? I know you've had a lot of discussions with people about this.
I think from an epidemiology standpoint, there have been a lot of questions about how can the hybrid model be as safe as possible. And from the models that we have available to us, it does seem as if the hybrid model will be a lower infection risk overall than having people in school. But both of those risks can be quite low when we have the white color coding or the green color coding that we have now. So we're talking about making a fairly controlled situation even safer. But the only way in which it would really be less safe is if people are really having a lot of contacts and a lot of exposures on the days that they're not in the school buildings. And so I think, like Mary Ellen said, sort of seeing this as part of the overall community-wide effort to create a safe situation for our kids to be back in school is what we're encouraging people to think about. What you do in your days off really does matter. So that includes not only pods, but in everything else we're doing. So, really important now not to be having indoor parties, not to be having sleepovers. In our current state of Massachusetts, it is permitted to dine indoors and to go to casinos and to go to bars that serve certain kinds of food. And I actually really encourage people not to do that right now. Like, if your goal is to get our kids back into school safely, let's prioritize that, and let's defer our adult things so that our kids can do the things they need to do to be kids. But I know that's hard. But focusing specifically on this question about pods, I think the simplest way the most sort of direct way to keep the risk low is if it would be possible to create a pod with the kids that your kids are already seeing when they're in school. So if it works out to create a pod with their classroom cohort, for example, at the elementary school, if you're an A-day second grader, if you could create a pod with an A-day second grader from your same classroom, that would be very little additional risk. I know that's not always possible because people are putting together all kinds of logistic considerations in making these pods. But when you're in your pod, as Mary Ellen said, like indoors, kids need to be masked. They need to be as much as possible 6 feet apart, as much as possible, keep the windows open and good ventilation, and do lots of hand washing and hand hygiene, all the same things that we're asking people to do here at school to try to keep the pods as safe as possible.
I think, and again, one of the most important things, if you're not feeling well, please stay home.
Yeah, don't go to your pod either. Again, to the backup plan. Like, your pod is also not good childcare if your kid is symptomatic, unfortunately, as inconvenient as that is.
And there's another, one of the other questions that came up was about youth sports. in our schools and in our town. So, Safdar, do you want to address this? I know you've been working with the athletic director.
Yeah, we have been. And so right now, the high school will follow whatever guidelines the MIAA puts out. And those guidelines are going to be very strict protocols, trying to cohort only a certain number of towns together in low and moderate risk sports. And that way, we'll work our best to keep our kids safe. Now, as far as town sports and club sports, that's something we don't have control over. So what I would, urge families to do is, if you are thinking about a recreational league that's not in school, especially for younger children, really check out the protocols. Make sure that they're following masking guidelines and distancing guidelines and appropriate cleaning protocols. Avoiding sports that are contact sports. Right now, there are certain sports that, football, hockey, lacrosse, those are contact sports that we're really trying to have people avoid, at least for the time being.
Oh, so does anybody have anything else that they've heard or want to discuss?
I received a couple of questions from parents. One was about flu shots. With the new flu shot mandate from the state, is there anything that we can do to make that easier for parents, especially parents of younger kids?
I can address that. So both in Northborough and Southborough, we are going to have our regular community-wide flu clinics. But in addition to that, we are hoping to add some more accessibility to families and students with additional school-based clinic, likely on the weekend. So more to come on that, but we are hoping to provide more opportunities to be able to get the flu vaccination to our students and community.
Great.
And I can't, stress the importance of that enough, because, unlike COVID-19, influenza is an illness that children can get and get very ill from, and is an illness where children do transmit. So getting the flu vaccine is paramount, especially now as we head into a winter alongside COVID-19.
Okay, so you can talk to your healthcare provider, and most of them have their flu vaccines ready to go from anywhere from July. After July, if you got your flu vaccine after July 1st, it's good, and we need to be vaccinated by December 31st. So there's more news to come. We'll wait to hear that from our local Board of Health.
Yeah. One other question that we got was, can we talk a little bit more about kind of what a day in the life at school would look like? And can we give parents some information about how the changes that we're implementing for safety might affect education and socialization and other things that we know are benefits of in-person school?
So to speak to that second part more specifically, children, after the few months that they spent indoors, have been craving socialization, and I think getting socialization, this new norm, has been a very positive thing. We've seen it all summer. We've seen it through children who have attended day camps and have attended daycare centers, wearing masks, being socially distant, and the interaction they've gotten in person has been extremely rewarding for them and has helped their overall emotional and social well-being. So they will be able to adjust to this, and really, I feel very confident that they will get a reward out of this, and it will contribute to their social and emotional well-being.
And I think school's going to look a little bit different, but it's still going to be school. They're still going to have their peers in their classroom. They're still going to have a teacher that they love and can't wait to see each time they're in. They're still going to have specials. They're still going to have recess. They're going to have art class. They're going to have music. They're going to be wearing masks. Mask breaks will be a part of the day, just like snack and lunch and recess already are a part of the day. So school is going to be what school has always been. It's going to be a great experience for everybody. And there's going to be a lot of that getting used to being in school for the first few days, like what's the new routine going to be? And that's how the first week of school is typically spent. These are our school routines. These are what we all need to do to keep each other safe. And that's how school always starts, no matter what year you're starting. And it's going to continue that way. So I think we can encourage our students to know that it's going to look a little bit different and people are going to wear masks, and we're going to be spread out a little bit more than we typically would in the lunchroom. But we're still going to have our friends with us, and we're still going to have art class. If your favorite part was music class, you're still going to have music class. You're still going to have gym and recess. So, and all of your teachers are still going to be there. So I think that it's important to just emphasize that things are going to be a little bit different, but a lot about school is still going to be the same. And it's so important that we're back in school for all of the reasons that everybody here has said, and all the social, emotional, and educational reasons to be back in school is so important. So please know, again, if you have any questions, don't hesitate to reach out to any of us.